Have you noticed changes in behavior that seem to come out of nowhere in your later years and wondered if they mean something important about your health? These aren't random occurrences or inevitable signs of aging that you should simply accept. By understanding these 6 behavioral patterns that medical professionals have identified, you'll know exactly when to seek help and how to address underlying health issues before they become serious problems that could dramatically impact your quality of life. What I'm about to share isn't about predicting death or creating fear, but about recognizing treatable medical conditions that often go unnoticed until they've progressed too far to reverse easily. When 78-year-old Eleanor from Michigan suddenly stopped answering her phone and began refusing visits from her daughter after decades of close family contact, her family initially thought she was just being stubborn or going through a difficult phase. 3 weeks later, when they finally convinced her to see a doctor, they discovered she had developed a treatable condition that was causing confusion and social withdrawal. Early recognition of these behavioral patterns saved Eleanor's life and gave her family 3 more healthy, engaged years together. Behavioral change. 1. Sudden social withdrawal and isolation. The first critical change that demands immediate attention is when seniors suddenly stop engaging with family and friends without any obvious reason or explanation. This isn't about gradually reducing social activities due to mobility issues or transportation problems, but rather an abrupt shift where someone who was previously social and engaged suddenly becomes withdrawn, stops answering calls, refuses visitors, or cancels long-standing commitments and activities they once enjoyed. Research from Harvard Medical School has documented that this type of sudden social withdrawal often indicates highly treatable conditions, including depression, medication side effects, hearing loss, vision problems, or early cognitive changes that can be successfully managed when caught early. The key distinction is the suddenness of the change rather than a gradual decline over months or years. Medical professionals at Harvard have found that social withdrawal often serves as an early warning system for underlying health issues that the person may not even recognize themselves. When someone suddenly isolates themselves, it's frequently because they're experiencing symptoms that make social interaction difficult, embarrassing, or overwhelming. These might include hearing difficulties that make conversations frustrating, vision problems that make them feel unsafe driving to social events, medication side effects that cause fatigue or confusion, or the early stages of depression that can develop after major life changes, medical diagnoses, or losses. The important thing to understand is that in most cases, these underlying causes are entirely treatable when identified by healthcare professionals. Ignoring this dramatic change in social behavior can lead to dangerous isolation that accelerates both physical and mental decline, creating a downward spiral that becomes increasingly difficult to reverse. Social isolation has been proven to increase the risk of depression, cognitive decline, falls, poor nutrition, and even early death by amounts comparable to smoking or obesity. When someone withdraws from their support network, they also lose access to the people who might notice other concerning changes in their health, behavior, or safety. The longer this isolation continues, the more difficult it becomes to reconnect and the more serious the underlying health issues may become. The immediate solution is scheduling a comprehensive medical evaluation with their primary care physician within 1 week of noticing this change, while also maintaining gentle, consistent social contact, even if they initially resist. Ask their doctor to specifically evaluate for depression, medication interactions, hearing and vision problems, and any new medical conditions that might be affecting their social comfort. Additionally, arrange for regular check-ins from family members or friends, Offer practical help with transportation to social activities, and consider involving a social worker or counselor who specializes in senior issues. Ramon from Arizona returned to his weekly card games and church activities after his doctor identified and treated a hearing problem that had made group conversations impossible to follow. Don't dismiss sudden social withdrawal as normal aging or stubbornness. Investigate the underlying cause today. Behavioral change. 2. Dramatic changes in eating habits or appetite. Why do some seniors suddenly lose interest in foods they've enjoyed for decades or dramatically change their eating patterns without any obvious reason? This second behavioral change involves sudden shifts in appetite, food preferences, meal timing, or eating behaviors that represent a significant departure from lifelong patterns. It might manifest as a complete loss of appetite, suddenly refusing favorite foods, eating only at odd hours, forgetting to eat meals entirely, or developing unusual food cravings or aversions. The Mayo Clinic reports that sudden appetite and eating changes often signal medication interactions, dental problems, depression, digestive issues, or taste and smell changes that are all highly treatable conditions when properly identified and addressed by healthcare professionals. Research conducted by nutrition specialists at the Mayo Clinic has shown that changes in eating behavior frequently serve as early indicators of medical conditions that seniors themselves may not recognize or report to their doctors. Medication side effects can significantly alter taste and smell, making previously enjoyable foods taste metallic, bitter, or completely flavorless. Dental problems, including poorly fitting dentures, tooth pain, or gum disease, can make eating uncomfortable or painful, leading people to avoid certain foods or meals altogether. Depression commonly manifests as changes in appetite, either complete loss of interest in food or occasionally increased consumption of comfort foods. Digestive issues, including acid reflux, stomach problems, or changes in metabolism, can also dramatically affect eating patterns and food preferences. The medical consequences of ignoring dramatic eating changes can be severe and develop rapidly in older adults. Nutritional decline leads directly to weakness, increased fall risk, impaired immune function, slower wound healing, and accelerated muscle loss that can quickly progress to the point where independence is lost. Poor nutrition also affects mental clarity, energy levels, and the body's ability to fight off infections or recover from illness. When eating problems persist untreated, they can lead to dangerous weight loss, dehydration, hospitalization, and a cascade of health problems that might have been easily prevented with early intervention and proper treatment of the underlying cause. The solution requires immediate action on multiple fronts to identify and address the root cause while ensuring adequate nutrition during the evaluation process. Schedule appointments with both a primary care physician and a dentist within 1 week to rule out medical and dental causes. Ask the doctor to review all current medications for side effects that might affect appetite or taste, and request blood work to check for nutritional deficiencies, diabetes, or other conditions that affect eating. Create a food diary, tracking what, when, and how much is being eaten to help healthcare providers identify patterns. Consider consulting with a registered dietitian who specializes in senior nutrition to develop strategies for maintaining adequate nutrition while the underlying cause is being treated. Maria from California regained her appetite and returned to enjoying family meals after her doctor identified and adjusted a blood pressure medication that was causing taste changes. Changes in eating patterns require immediate medical attention because nutritional decline happens quickly in seniors. Behavioral change. 3. Increased confusion or memory problems. Sudden increases in confusion, memory problems, or changes in mental clarity aren't normal parts of aging. and often indicate completely reversible medical conditions that require immediate attention. This behavioral change involves new or rapidly worsening episodes of confusion, disorientation, memory loss, difficulty making decisions, problems with familiar tasks, or changes in judgment that represent a clear departure from the person's normal mental functioning. It's important to distinguish between the gradual, mild memory changes that can be part of normal aging and the sudden or rapidly progressive confusion that signals an underlying medical problem. Johns Hopkins research has documented that rapid cognitive changes frequently result from treatable conditions, including urinary tract infections, medication interactions, vitamin deficiencies, dehydration, sleep disorders, or undiagnosed medical conditions. The specialists at Johns Hopkins have found that what families often interpret as sudden onset dementia or inevitable mental decline is actually caused by medical conditions that can be completely reversed when properly treated. Urinary tract infections are particularly notorious for causing dramatic confusion in seniors, often without the typical symptoms of burning or frequent urination that younger people experience. Medication interactions become more common as people age and take multiple prescriptions, and even small changes in kidney or liver function can cause familiar medications to build up to toxic levels that affect brain function. Vitamin deficiencies, particularly B12, thiamine, and vitamin D, can cause serious cognitive symptoms that completely resolve with proper supplementation. The consequences of not addressing sudden cognitive changes immediately can be devastating and potentially irreversible if the underlying cause is allowed to progress untreated. What starts as mild confusion can rapidly progress to severe disorientation, dangerous decision-making, increased fall risk, inability to manage medications safely, and loss of the ability to live independently. Additionally, the longer certain medical conditions like infections or medication toxicities continue untreated, the more likely they are to cause permanent brain damage. Families often make the mistake of attributing these changes to normal aging or early dementia, missing the window of opportunity for complete recovery that exists when the real cause is identified and treated promptly. The immediate action plan requires treating this as a medical emergency that demands comprehensive evaluation within 24 hours of noticing significant changes. Contact the primary care physician immediately to arrange urgent evaluation, specifically requesting tests for urinary tract infections, complete blood work including vitamin levels, and a thorough review of all medications and supplements. Keep a detailed log of confusion episodes, including timing, duration, and any potential triggers, to help healthcare providers identify patterns. Ensure the person is staying well hydrated and getting adequate sleep, as both dehydration and sleep deprivation can worsen cognitive symptoms. Remove any safety hazards from the environment and arrange for supervision until the cause is identified and treated. Vernon from Florida returned to his normal mental sharpness within 48 hours after treatment for a urinary tract infection that had been causing severe confusion and disorientation. New or worsening confusion is a medical emergency that needs evaluation immediately, not something to wait and see about. Behavioral change. 4. Neglecting personal hygiene and appearance. What does it mean when someone who was always well-groomed and took pride in their appearance suddenly stops caring about personal hygiene, clothing, or grooming? This fourth behavioral change involves a noticeable decline in personal care standards, including poor hygiene, wearing dirty or inappropriate clothing, neglecting dental care, or showing a general disregard for appearance that's completely out of character. It's not about minor changes in grooming preferences or occasional lapses, but rather a significant and sustained change in self-care that represents a departure from lifelong habits and standards. Studies from the National Institute on Aging indicate that this behavior change often signals depression, physical limitations, cognitive changes, chronic pain, or vision problems that all respond well to appropriate treatment and support when properly identified and addressed. Research conducted by geriatric specialists has shown that neglecting personal hygiene is rarely about laziness or giving up, but rather indicates underlying medical or psychological conditions that make self-care difficult, painful, or overwhelming. Depression commonly manifests as loss of interest in personal appearance and self-care, along with fatigue that makes basic grooming tasks feel insurmountable. Physical limitations such as arthritis, back pain, or balance problems can make tasks like showering, dressing, or grooming dangerous or extremely difficult without proper assistance or adaptive equipment. Vision problems can make it impossible to see when clothing is soiled or to perform grooming tasks safely. Cognitive changes can affect the ability to remember self-care routines or recognize when personal hygiene attention is needed. The medical and social consequences of ignoring changes in personal hygiene can quickly escalate into serious health and safety issues that affect every aspect of a person's life. Poor hygiene leads directly to skin infections, dental problems, urinary tract infections, and other medical complications that can become serious enough to require hospitalization. Social isolation often follows as the person becomes embarrassed about their appearance or others begin to avoid contact. This isolation then worsens depression and reduces access to help and support. Additionally, neglecting personal care can be a sign of declining ability to manage other important tasks like taking medications correctly, maintaining home safety, or managing finances appropriately. The solution involves offering practical assistance while simultaneously addressing the underlying causes through appropriate medical and professional evaluation. Arrange for occupational therapy evaluation to assess physical limitations and recommend adaptive equipment or techniques that make self-care easier and safer. Schedule medical evaluation for depression, pain management, vision problems, and any other conditions that might be interfering with self-care abilities. Consider arranging for home health aid services to provide assistance with bathing, grooming, and dressing while underlying issues are being addressed. Make environmental modifications such as grab bars, shower seats, and improved lighting to make self-care tasks safer and easier. Brenda from Oregon returned to her normal standards of self-care after treatment for arthritis pain made it possible for her to shower and dress comfortably again. Personal care changes signal the need for immediate support and medical evaluation, not judgment or criticism. Behavioral change. 5. Talking about death or getting affairs in order. Sudden preoccupation with death, urgent completion of final arrangements, or frequent conversations about dying often indicates treatable depression, anxiety, or undiagnosed medical conditions rather than any kind of premonition or acceptance of impending death. This behavioral change involves new or increased focus on death-related topics, rushing to complete wills or funeral arrangements, giving away possessions urgently, or repeatedly expressing beliefs that death is imminent without medical evidence to support these concerns. While it's healthy and appropriate for seniors to have their affairs in order, the key concern is when this becomes a sudden preoccupation or urgent compulsion that's accompanied by distress, anxiety, or depression. Research from the American Geriatric Society shows that this behavior frequently accompanies medical conditions that affect mood and cognition, including depression, anxiety disorders, medication side effects, or undiagnosed physical conditions that are causing subconscious worry about health. Mental health specialists have documented that what appears to be preparation for death is often actually a symptom of treatable psychological or medical conditions that are affecting the person's outlook and emotional state. Depression commonly causes preoccupation with death and dying, along with feelings of hopelessness that make death seem preferable or inevitable. Anxiety disorders can create overwhelming fears about health and mortality that drive compulsive preparation behaviors. Some medications, particularly those used for blood pressure, heart conditions, or sleep problems, can cause side effects including depression, anxiety, or mood changes that lead to morbid preoccupations. Additionally, subconscious awareness of physical symptoms or changes can sometimes manifest as death-related anxiety before the person or their doctors have identified the underlying medical condition. The emotional and practical consequences of not addressing this behavioral change appropriately can be severe for both the individual and their family members. Untreated depression and anxiety tend to worsen over time, leading to decreased quality of life, social isolation, poor self-care, and in severe cases, thoughts of suicide or self-harm. Family members often become distressed and frightened by these conversations, not knowing how to respond appropriately or whether to take the concerns seriously. Additionally, making major financial or legal decisions while experiencing depression or anxiety can lead to choices that don't reflect the person's true wishes or best interests. When these discussions are dismissed as normal aging or morbid curiosity, opportunities for treatment and improvement are lost. The appropriate response requires taking these concerns seriously while simultaneously arranging for professional evaluation to identify and treat any underlying conditions. Schedule an appointment with a mental health professional who specializes in geriatric issues within 1 week to evaluate for depression, anxiety, or other mood disorders. Request a complete medical evaluation to rule out physical conditions or medication side effects that might be affecting mood or causing physical symptoms that are creating health anxiety. Encourage open, supportive conversations about these concerns while also gently exploring whether there are specific health worries or symptoms that are driving the preoccupation with death. Consider family counseling to help everyone learn how to respond supportively to these discussions while encouraging appropriate professional help. Walter from Arizona returned to his normally optimistic outlook on life after counseling and treatment for depression that had been causing overwhelming feelings of hopelessness. These conversations about death are often calls for help that need immediate response, not topics to avoid or dismiss. Behavioral change. 6. Changes in sleep patterns or daily routines. Why do lifelong early risers suddenly start sleeping all day? Or people who've maintained consistent schedules for decades suddenly develop completely chaotic daily routines? This final behavioral change involves dramatic shifts in sleep patterns, daily schedules, or routine activities that represent a significant departure from lifelong habits. It might include sleeping much more or much less than usual, being awake all night and sleeping during the day, abandoning long-time routines like morning coffee or evening news, or showing general disorganization in daily activities that were previously automatic and consistent. Sleep specialists at Stanford Medical Center report that dramatic sleep and routine changes often indicate pain conditions, medication effects, depression, anxiety, sleep disorders, or underlying medical conditions that are affecting the body's natural circadian rhythms. Medical research has established that sleep and daily routine disruptions in seniors are rarely due to simple preference changes or normal aging, but rather signal underlying health conditions that require professional evaluation and treatment. Chronic pain conditions often worsen at night, making it impossible to maintain normal sleep schedules and leading to daytime fatigue that disrupts entire daily routines. Medications can significantly affect sleep patterns, either causing drowsiness that leads to excessive daytime sleeping or stimulating effects that cause nighttime wakefulness. Depression and anxiety frequently manifest as sleep disturbances, including early morning awakening, difficulty falling asleep, or sleeping much more than usual. Sleep disorders such as sleep apnea, restless leg syndrome, or periodic limb movement disorder become more common with age and can completely disrupt normal sleep architecture. The health consequences of ignoring dramatic sleep and routine changes can be severe and far-reaching, affecting every aspect of physical and mental health. Poor sleep affects immune function, making it harder to fight off infections and recover from illness. It significantly increases fall risk due to fatigue and poor balance, and impairs mental clarity, memory, and decision-making abilities. Disrupted sleep also affects blood sugar control, blood pressure regulation, and heart rhythm stability. When daily routines become chaotic, it often leads to missed medications, poor nutrition, reduced social contact, and increased safety risks. The combination of poor sleep and disrupted routines creates a downward spiral that accelerates both physical and cognitive decline. The solution requires systematic evaluation of both sleep patterns and potential underlying causes, while implementing immediate strategies to improve sleep quality and routine stability. Track sleep patterns for 1 week, including bedtime, wake time, nap times, and any nighttime awakenings, to provide specific information to healthcare providers. Schedule appointments with both a primary care physician and, if available, a sleep specialist to evaluate for sleep disorders, medication effects, pain conditions, and other medical causes of sleep disruption. Create a consistent bedtime routine and sleep environment that promotes better rest, including comfortable temperature, darkness, and minimal noise. Consider whether pain, bathroom needs, or other physical issues are interfering with sleep and address these specifically. Betty from Nevada returned to her normal sleep schedule and daily routines after her doctor identified and treated sleep apnea that had been causing severe nighttime disruption. Sleep and routine changes require immediate medical attention because they affect every aspect of health and safety. These behavioral changes aren't inevitable parts of aging or signs of impending death that you should simply accept as unavoidable. They're your body's way of signaling that something treatable is happening that deserves immediate attention and professional evaluation. Thousands of seniors have regained their quality of life, independence, and peace of mind simply by recognizing these patterns early and seeking appropriate help from healthcare professionals who specialize in senior health issues. If you recognize any of these changes in yourself or someone you care about, please share this video to help other families catch these important warning signs early and get the help they need. Hit the like button if this information could help you or someone you love maintain better health and independence, and tell me in the comments which of these behavioral changes you've noticed in yourself or others. Your experience and insights could help other viewers recognize when it's time to seek professional help and support.